Hey everybody, Dr. Chris from Human 2.0, and here are 4 things that you do or say that make me as an orthopedic surgeon know that you have weak glutes after an injury or surgery. So the first thing that you might do if you have weak glutes is walk with a limp. Because the role of the glutes, particularly the glute med and the glute minimus, is to keep your pelvis level when you are walking on a single leg, if you have weakness in those muscles, it causes your pelvis to drop away from the injured side or the weak side when you're walking. The second thing that you might do is have a positive Trendelenburg sign. Basically, when you stand on one leg, your pelvis drops to the side opposite the leg that you are standing on. If you have normal glute strength, when you stand on one leg, your pelvis is maintained parallel to the floor or level to the ground. This is a negative Trendelenburg. But if your glutes are weak, then your pelvis will drop down away from the leg you're standing on. This is a positive Trendelenburg sign. The third thing that you might do or say is complain about pain at the side of your hip when you're walking. This hard bump that you can feel on the side of your hip is called the greater trochanter. And this is where the gluteal muscles attach. If you have weakness, you may have some pain there. In addition, you may have some irritation from the IT band over top of this area as well. And finally, you may also complain about pain at the side of your knee when walking. The iliotibial band runs from the crest of your pelvis to the outside aspect of your knee. And when your glute muscles are weak, the iliotibial band helps out to help maintain your pelvis level when you're walking. Because of the tension generated in the iliotibial band, you might have some pain where it inserts on the lateral aspect of your knee. So if you have weak glutes after an injury or surgery, don't worry, it's not the end of the world. Here are 2 exercises that you can use to strengthen your own glutes so that you don't have this problem. The first exercise is a variation of a glute bridge, and this is a little bit more advanced variation, and this is a hip thruster. You can do this with barbells, but you can also do it with a kettlebell as well. For this exercise, you're going to hold the kettlebell right at the level of your pelvis. You're going to sink down with your shoulder blades firmly on the seat of the chair, and then you're going to drive your hips up towards the ceiling, making sure that you're holding onto the kettlebell so that it doesn't go flying, and you're going to do repetitions. An easier version of this, of course, is to just do an isometric hold at the top for 15, 30, or 60 seconds. And if you want to make it harder, then you just use a heavier kettlebell or a heavier barbell or even potentially a heavier sandbag. The second exercise is going to be an isometric half squat with the legs in an abducted position. So you'll need a band for this. You can increase or decrease the difficulty by selecting a band of the appropriate tension. And so for this exercise, you're going to put your feet just a little bit wider than shoulder width, and you're going to go into a half squat position. And then in this position, we're going to pull our knees apart against the resistance of the band. And you're aiming to hold this for 15, 30, or 60 seconds. And trust me, this is going to get your cheeks to light up. And as you can see, when I'm doing this, there is some vibration of my legs as my glutes start to fatigue. So if you're going to do the isometric hold, start out easy with a thin band and work to hold it for 15 seconds. Once you can do that regularly, work up to 30 seconds, and with the eventual goal of you being able to hold it in the abducted position for 60 seconds. And usually I would do 3 rounds of 8 to 10 reps for the kettlebell thrusters, and likewise, I would do 3 rounds of holds for the half squat against the resistance band. So hope that was of value for you. For more exercises and workouts, be sure to follow us right here on YouTube, Human 2.0 Fitness, where we help you move better and prevent injury.